Welcome to the program. I'm your host, Neil Howard. Thank you so much for joining us. We're going to be speaking this morning with Mr. Asher Brass. He's joining us here from Cynerio. Cynerio is a leading provider of healthcare IoT, cybersecurity, and asset management solutions. He's joining us to talk about the company's recent discovery of JekyllBot 5. Welcome to Health Professional Radio, Mr. Asher Brass. Thank you for joining us.
Thank you for having me.
Well, tell us a bit about yourself and your role at Cynerio.
Absolutely. So I've been in the cybersecurity profession for about 9 years now. I started in the IDF here in the Israeli Army and military intelligence, and I've been with Cynerio for about a year and a half now. I'm head of the Cynerio Live team. What we do in our team is quite a bit of network research, cybersecurity related research, trying to figure out how we can best identify different medical devices on our customers' networks, how we can see different kinds of IoT devices, and how we can flag risks for them, and also help prioritize for healthcare providers which risks are most urgent and which ones they should deal with and how exactly they should help mitigate those risks on their networks.
Just before we talk about Cynerio's recent discovery of a 50-day vulnerability, collectively, as I said, called JekyllBot 5, what is IoT security?
Absolutely. So IoT, also known as Internet of Things, well, it's a little funny, but it's basically anything that is connected to a network that you wouldn't normally think of as a computer or some sort of classic IT device, right? So if you have a smartwatch connected to a network, that's IoT. Even your phone is technically considered IoT, but also things like, temperature monitors and pneumatic tube systems and all kinds of strange and interesting devices that might be connected to a healthcare network.
I've been in hospitals lots of times, and there are many, many devices that I wouldn't really think of as a computer, like a laptop or something that I could do any work on. Are you saying that the majority of these devices are connected to some type of network?
Absolutely. It's a really good point, actually. I'm often shocked when I walk into a hospital nowadays by how many things I would never have even considered, would be connected to a network, have no real purpose, in my opinion, to be connected to a network. But then once you actually, are in a hospital's network and you see what they're doing and why they're doing that, I guess it makes sense from a certain perspective. But yeah, the amount of interconnectedness of devices inside hospitals nowadays is staggering.
0-day vulnerabilities. What are these 5 0-day vulnerabilities that have come to be known collectively as JekyllBot 5?
Yeah, so I'll explain a little bit about the product first that we found them on, and then I can explain what the vulnerabilities actually lead to. So Aethon manufacture a semi-autonomous smart robot called TUG. It's actually a brilliant little device. It steps in and helps hospitals deal with a lot of things that they previously had trouble with, like massive transportation of, sometimes things that don't seem that important, like linens and cleaning supplies and things like that, but also pharmaceuticals from place to place. Laboratory samples, sometimes between labs, sometimes, hospital staff have to cover great distances. And these are really tasks that you could automate, and you can automate with these smart robots. And they can be pre-programmed to carry out routine tasks every so often. So all in all, a product that's very useful and obviously needs to be communicated with through the network of a healthcare provider.
Now, when we're talking about these TUG robots, are we talking about the type of robot that can actually deliver meds to a room like a smart car, or are we talking about bots on a network that are assisting with the transfer of data?
No, I'm talking about a physical robot.
Okay.
They have various models, but it can come to about 4 feet tall.
Okay.
And it will even greet you if it sees you in the corridor. It'll say good morning or good afternoon or some sort of respectful greeting. And in theory, you could use it to deliver medication to patients, although as I understand, that is not the intended function, nor is that the recommended function. It's typically for transportation of medicine between pharmacies or from pharmacy to a staff that then does the dispensation.
These are found all over the world, these TUG robots, correct? In hospitals everywhere.
Absolutely, absolutely. There a lot of them in the United States and North America, but also in Europe and Asia. We've found evidence of them being all over the place, really.
Now, I also understand that Cynerio also recently released a State of Healthcare IoT Device Security report. Give us some insight to the main takeaways of this report.
Absolutely. So, there's a lot of anecdotal data and stories when you talk to healthcare providers about whether their devices are or aren't secure. We did a very interesting thing, which is we aggregated a lot of data, obviously anonymized data to protect patient safety and our client safety and stuff like that. But we did aggregate a lot of data, and we really proved and showed just how insecure these networks can be. And it really, some of the numbers are astonishing. More than half of all connected medical devices, so things like infusion pumps and patient monitors and ventilators, more than half of these medical devices have known critical vulnerabilities that could allow for disruption of service or data leakage or even total takeover by an attacker. Just as, well, I actually didn't mention about the vulnerabilities, but the JekyllBot 5 vulnerabilities allow for a complete takeover of the Aethon robots. So in a similar way, these are critical vulnerabilities on these robots that could allow an attacker to, well, the imagination runs wild. I'm sure you can imagine with physical robots that can move around the hospital what sort of damage they could cause.
Understanding that cyber criminals are constantly trolling the network of this organization, that organization, looking for vulnerabilities. Can't the process weed out these vulnerabilities because they're obviously built in if they have to be exploited? They already exist.
Well, sometimes they already exist. Sometimes they're newly discovered. Sometimes they're what you might call emergent behaviors, right? If you buy a medical device, for instance, you might say, okay, well, this vendor, I trust this and this vendor, and I'm sure that they did their due diligence. But the vendor is relying on numerous other softwares and libraries that are installed inside those softwares, and it gets genuinely difficult to keep track of what this device may or may not be capable of. And really seeing it in a real world environment shows you all kinds of vulnerabilities you might not know just from reading about it in a spec sheet or something like that.
Tell us more about JekyllBot 5, if you would.
So the JekyllBot 5 vulnerabilities are basically two different ways, right? These vulnerabilities sum to two completely independent ways of for an attacker to take control of these Aethon TUG robots that I mentioned earlier. And once the attacker has that control, they can manipulate these devices in various ways. They can move them from place to place. They can take pictures of patients, staff, and of the facility. And they can even unlock drawers or interfere with day-to-day clinical activities in a way that can be incredibly disruptive to a hospital. And closing one of these vulnerabilities is not enough. You really have to close all five in order to make sure these devices are secure. Cynerio works very closely with Aethon, with the manufacturer of these robots, in order to come up with some patches that do actually mitigate and fix these vulnerabilities. And if you have this product, please make sure you reach out to Aethon and that you have the latest patch version that secures these devices. I think one of the things that hospitals can do, and some of them are starting to do this, but they really need assistance because it's a complicated process, is to segment their networks internally. So, the classic approach to security is if I make sure that nothing bad comes from outside the network, then I won't get infected in the first place, and then I'll be safe. But it's getting harder and harder to track what could and couldn't get into a hospital's network. And so it's really becoming more and more important to segment various parts. So if I have infusion pumps, I want to make sure these infusion pumps can only talk to the server they're supposed to be able to talk to, no one else. And that way, even if there is an infection in my network, I'm keeping the most critical devices secure because they can't communicate with any infected machines.
How much responsibility is it on the client to tackle that learning curve and do some of their due diligence? And how much lies with Cynerio to make sure that they have each and everything that they need to mitigate these threats?
So we need very little from the healthcare providers in order to start giving them, day one protection. Basically, what we need is a cooperation agreement with them and some sort of network access. And then that's all of the information they have to provide us in order for us to start our work. Mm-hmm. Obviously, once we get to the stage of mitigating risks and trying to figure out how we can make sure that if there is an attack, it's not as severe as it could be, or avoid attacks in the first place, obviously then we do need cooperation from the actual IT or security staff in the hospital in order to make sure that those are implemented.
Asher, give us a website where our listeners can learn more.
Absolutely. You can go to Cynerio.com and you can find additional information about our data report and also about the JekyllBot 5 vulnerabilities there.
And Cynerio is spelled CYNERIO.com. Is that correct?
Correct.
Great. It's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio and providing this information.
Thank you. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Asher Brass, head of Cyber Network Analysis Team at Cynerio. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.